Scripps Health is still dealing with that system-wide cyber attack, and last week one of the country's largest pipelines shut down because of hackers as well. So what's going on here? Cybersecurity expert Tyler Hudak joining us now with more. Tyler, good morning.
Morning.
I'd ask this question, how did this happen? But I think we have an idea. I mean, not technically how it happened, but why did this happen?
Well, ransomware attacks are huge right now. Ransomware attackers know that that's how they get money. It's almost a guaranteed payment. And because of that, we've seen ransomware attacks in the last year or so just increase because, the attackers know that they're going to get paid, and it's often very easy for an attacker to get into an environment and move around and eventually deploy their ransomware.
Is this one of those concepts where if you keep paying for the ransomware, then they're going to keep doing it? It's a vicious cycle.
It absolutely is. And unfortunately, until there are repercussions for paying a ransom attack, this is just going to keep continuing. Cyber insurance companies, they will pay out ransoms. Unfortunately, some organizations, they just don't have a choice but to pay a ransom, either to get their data back or to prevent their data that's been stolen from being released to the public.
You mentioned over the past year, was that, coincidentally with the pandemic, these attacks increased?
Definitely not coincidentally. As more and more organizations had to have a remote workforce, they set up remote access. Oftentimes this was done insecurely. And with more people working from home, everybody's home networks are likely less secure than a corporate network. And because a corporate network has probably less control over the home network, it's just a breeding ground for the attackers to get in and move into an organization from somebody's home network.
And are they just going for any and all businesses just trying to get more money? Like everybody's up for grabs?
Absolutely. I mean, if you are in an organization that makes money, you have an internet connection, then you are a potential victim. We have seen businesses from all industries affected: manufacturing, hospitality, government, obviously healthcare. And so because of that, everybody could be a potential victim.
Wow. What makes hospitals in particular more vulnerable to these types of attacks, and how can patients and how can they protect the information here? That's critical.
Yeah, hospitals are really good at protecting the data because of regulations like HIPAA.
Right.
But they do have their hands tied in other areas. There are a lot of systems, particularly patient-connected systems, that are more vulnerable because they're not allowed to be patched. They're not allowed to have software like antivirus put onto it. And so you get into an environment that has varied security controls within it. That in turn, once an attacker gets into an environment like that, they're very easily able to start moving through the environment, compromising systems, and in this case, eventually deploying ransomware.
I wanted to ask you how long it takes to recover from something like this, especially in a healthcare system, because this isn't like somebody tells you, oh, your email got hacked, change your password. It's not as simple as that when it comes to these massive companies and corporations.
No, we work at ransomware attacks all the time with various victims. And a lot of companies, when they first go into it, they get compromised on Fridays when all the ransomware goes out. They think they're going to be up and running by Monday. It is weeks to months for a full recovery because there are so many things that need to happen. You need to go through, you need to make sure that your systems are no longer compromised. There's no longer any backdoors. Oftentimes systems go down because they've just been in place for years and years. So it is a very long recovery process.
So how do individuals protect themselves? Because a company and a corporation is one thing, but Joe Schmo sitting at home on his laptop, you can get the same problem.
Yeah, absolutely. So it's really just following basic security protections.
Yeah.
Make sure you're using a good password. Don't click on random links in emails or open documents if you're not expecting them. Things like that. Don't download pirated software. A lot of these things are what is going to allow attackers to get onto your systems. And again, we're just seeing so much ransomware out there. Eventually, you're likely, if you get compromised, it's going to turn into ransomware because the attackers know that's a good way for them to make money.
You always hear from politicians who exactly is behind this. You hear the usual suspects, China, you hear Russia. And I've read about sometimes for hacking is like a job over there. You check in, it's a 9 to 5. You walk into a place and this is your job, to hack into systems.
Yeah, absolutely. Attribution is extremely difficult for being able to, tie who is behind an actual attack. With some of these cases, we're able to determine it very quickly because, or at least the group that's involved, because they leave their calling card. Ransomware attackers, you know who they are because they want to get paid. Now, tying them to individuals or what country of origin they're from is very difficult just because of it's very easy to anonymize your connections
Yeah.
online or over the internet. So unfortunately, being able to point to somebody to sue usually requires nation state level resources
Right.
through law enforcement.
It's just like the president said about the pipeline hack. It wasn't Russia, but it was in Russia.
Correct. The group behind the pipeline attack is a group known as DarkSide.
Yeah.
It's commonly believed they're from Russia. Interestingly, they've already come out on their website stating that this wasn't politically motivated or anything like that. They're just in it to make money, essentially.
Wow. All right, Tyler Hudak, we thank you for the time and thanks for the work you're doing to try to keep us safe over here.
Absolutely. Thank you.